Yo, what's up, internet? So, decided because I've been hearing a lot of COVID conspiracies and stuff like that, and I hear them talking about the government wanting to do this, do that, do yada yada. I think it's important that we go back in time a little bit and maybe do a little bit of math. And I'm hoping to explain why lockdowns were useful when they were, and why the government was so insistent upon people getting vaccines. And maybe we'll cover a little bit what the alternatives to them being so insistent might have been. So first, let's go here. We're going to use Los Angeles because I live in Los Angeles. It's kind of like our test, uh, like our little test dummy for this example. And you can get your own local information and do this exact same kind of test. First, I want us to look at the population. So for this, because other information I use down the road is all about hospitals in just Los Angeles City and the unincorporated areas, we're only going to look at that. Okay, so that's for Los Angeles City and its unincorporated areas, which, if you live in LA, you know what that is. It's 3,820,000 for the city itself, and about a million is the best guess we have right now for the unincorporated area. So that brings us up to 4.8 million, we'll say. Okay. Now, I want to go look at the hospitalization rate for people who have COVID. Um, when I first looked at this numbers, I used obesity rates, and that's like the top end of where if everything went to a shit show, replace the actual rates we had with 40%. The actual rates we're going to be looking at is about 1%. I'm getting this from PMC. This is like a scientific article from the National Library of Medicine. We're skipping directly to the results just because I want to keep it as simple as possible. You can dive in a little deeper and, really analyze the shit out of this later if you want to. If you do, it comes out to a lot of old people die. But they said out of the 3 million cases that they had, and they explained how they got that number. There's like 3,583,000 cases. They estimated about 1,093 for every 100,000 people with COVID 19. So that's our number, 1,093 out of 100,000. That gives us approximately 1%. Now, I want to go back to the population of Los Angeles. I'm going to bring up my calculator. I don't think my screen's going to capture it, so you're just going to have to trust me on this or play along and use your own calculator. We're going to say 3,820,000. Oh, missed some numbers there. 820,000. Boom. Times, or not times, sorry. Plus 1 million for the unincorporated areas of Los Angeles. That brings me to 4,820,000. I think we all agree on that. I'm now going to multiply that by 0.01, that's 1%, to give us about 48,000 serious hospitalizations. Okay? So that's our number right there, 48,000, about, estimating for this thought experiment. Look at the number of beds. That this is it's taken from the Hospital Association of Southern California. Um, it's kind of like an analysis of hospital capacity. We're gonna go down, and it looks like we have in this was for Los Angeles, I believe. Yeah, I should double check that. It's really hard to find like hospital just for City of Los Angeles hospital beds. It's really hard to find hospital beds. But going down here, here's the numbers we want: bed occupancy by classification, and this gives us our occupancy percentage. And right now we have 7,000 staffed beds, which I don't know if it's in this chart, but in another graph that I looked at before I started recording, it showed registered nurses, and that's what they mean. There's a shortage of nurses at the moment also. So for staffed beds, there's about 7,000. For licensed beds total, that's 11,000. You can go down here and you can see the occupancy ratings for each type of bed. You can also see the total numbers of beds just for Los Angeles City. There's 1,000 ICU beds. They were at 94.5% occupancy. That means they were pretty much filled to the fucking brim as far as like a big organizational system goes. Looking at this, we can even do the math. That's 5 for every 100. That's like 50 beds were empty, and they were probably in between getting patients for the entire city in 2021. For observation, there were 784 beds across the city, 97% occupancy. Medical and surgical, those were 5,000 beds, 96% occupancy. Pediatric, 53%, which is about what I imagine a normal year probably looks like. Psychiatric adult, 95%, because it was, keep in mind, everything was fucked with people's heads. The lockdowns did have a negative mental effect, but look at these numbers here. Holy every bed in every area for like helping people during a contagious outbreak or some kind of emergency, daily needs. That's mainly these three right here: ICU, observation, and medical surgical. Those were filled to the brim. We had no room to put more people. So the point I want to say is that we had these lockdowns in place, and the vaccine rollout was pushed very, very hard by the government, because you can't open up if you're just going to fill your hospitals beyond breaking point and everyone just starts dying because you don't have the hospital beds or the staff to treat them, right? So you can't open up from the lockdown unless people get vaccinated. All right, the vaccinations allowed people to open up without overflowing the hospitals. And if you even look at the data, which I don't have it pulled up right now, but the data from that showed that even when they did open up and people were able to go out, and some people didn't have their vaccination and they still went out anyways, we all know who you are, that led to a really insane like spike in hospitalizations and deaths from COVID. Not as big as the initial one, but like pretty sizable. You can point out where it is. You can see like, oh shit, that's when people started to stop giving a fuck about the lockdowns, and that's where the fucking spike starts. It's insane. So don't give in to these revisionist people trying to say, oh, the government's after you for nefarious reasons or some shit. The lockdowns were these evil mega minds. There's a really simple mathematical way to work this out, right? Look, we had, what was our number? 48,000? 48,000 people is going to be like over 4 times what we're able to carry in Los Angeles alone. And then if you go into rural areas, you're a lot more spread out from your hospitals. There's a lot less of them because there's a lower population. You don't need them as much. And it's just, I imagine it's even worse for the rural areas. I haven't done the math on it myself, but you should look it up, do the math. But yeah, I hope that educated you guys a little bit, maybe, hopefully, probably. Maybe you fucking hate me, that's cool. But yeah, just like this revisionist history is getting me mad, so I had to get the truth out there a little bit. Y'all have a great night. Love you. Bye.